For very obese people who need more than diet and exercise, weight loss surgery can be life-saving. Depending on the type of weight loss surgery, patients often lose 30 to 50% of their extra weight in the first 6 months after surgery. Yet weight loss surgery is major surgery and does come with small but serious risks. Today, we'll be hearing all about the different kinds of weight loss options, as well as if they might be an option for you or someone you love. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. Dr. Andre Teixeira from the Orlando Health Bariatric and Laparoscopy Center is here to tell us about options people might have to lose weight surgically. Thank you for being with us.
Thank you for having us here.
So let's define bariatric surgery. What exactly do we mean when we say that?
So bariatric surgery, back in the days, used to be defined as a weight loss option, as a surgical weight loss option. Nowadays, we tend to define bariatric surgery more as a metabolic operation, meaning it's a surgery that will help you to lose weight, but also will take care of your comorbidities, meaning high blood pressure, diabetes, high cholesterol, fatty liver, polycystic ovarian disease, which is #1 cause of.
Now, what was the last one?
Polycystic ovarian disease.
Okay, and all of these have a component attached to being overweight.
Yes.
Okay, so if I hear you correctly, that surgery is not just for weight loss.
Correct.
Now that's a new twist that we've not heard before.
Correct. Unfortunately, everything that we do is driven by insurance companies. So, like we were talking before, everything is driven by BMI.
Now, BMI, we see that number. What exactly, those letters, what exactly does that mean?
It's the body mass index, your body mass index. And it helps the insurance to kind of determine, are you overweight, supermorbid obese?
Is it the ratio of muscle to fat in
It's
the
the ratio
body?
of your height with your weight.
Height
basically.
and weight,
Yeah.
okay.
So when we do that, we calculate a number. And depending on that number, and depending on how many comorbidities you have, you might be a candidate for the surgery.
Okay, let's talk about the kinds of surgery, because there's not just one.
Correct.
Tell us about the different kinds.
So, there are 4 surgeries done mostly in America. One is the lap band, okay, which is an operation that only restricts how much you can eat.
Okay.
The second operation is the sleeve gastrectomy. It's an operation that we take about 85% of your stomach out, remove, and that causes a restriction.
So you move it?
I remove it.
You remove 85% of the stomach. Okay.
I completely remove from you, that's gone. And that causes restriction and decreases your appetite. So that's where the band doesn't do, the sleeve does, which is decrease your appetite. The third option is the gastric bypass, which we know since the 1960s. It's an operation that does the same thing. We reroute or replumb your small intestine with your stomach in a way that's going to cause restriction, decrease your appetite, and malabsorption. What I mean by malabsorption is not everything you're going to eat is going to get absorbed. So it's going to help with the weight loss.
So 3 different kinds. Is one riskier than the other?
They are all done laparoscopically or robotically. One operation takes longer than the other. Like the bypass takes a little bit longer than the sleeve. The risks are all pretty much the same, which is very minimal in our hands, in our institution, because we take all the steps necessary to prevent that.
Who is is or is not a good candidate for bariatric surgery?
So I think you got to look at, does the patient have severe comorbidities? Does the patient qualify?
Meaning high blood
high
pressure,
high cholesterol, diabetes, which is a big one that definitely is going to help. Is the patient motivated, right? Does the patient has a good support system? Is the patient looking for a quick fix? Because the surgery is not really a quick fix. It's a long-term fix that's going to help to revamp your lifestyle completely. And like I always tell my patients, the surgery is just a tool, right? It's just the easiest part of the whole procedure. The hardest part is come afterwards, which is learning how to eat again, support system, friendships.
So much of this is psychological and social.
Correct.
So how do you prepare a patient for those changes?
Correct. So we have in our own practice, we have our own psychologist that kind of helps helps the patient to proceed before. They have to have an evaluation before to see if they're fit to have the surgery, and afterwards. I think it's very important for you to have someone to help you, to guide you afterwards. Because food, if you think about it, food is just a drug. It's a comfort drug, right? I mean, we're stressed, we eat ice cream, we eat whatever high sugar stuff to calm you down. Sugar makes you calm down. So you won't be able to do that anymore. So you have to find other things to calm you down. That's why you see people going to gyms, doing CrossFit or whatever you like.
To substitute.
To substitute.
That. So who's not a good candidate?
When I see patients that they've been sick for many, many years, have heart issues, severe heart problems, require a large amount of oxygen, above the age of 72, those I tend to be very cautious in operating those patients. And also patients that are very young in a way of choosing the right operation for those patients.
What is the average age, or is there an average age? And who has this kind of surgery more? Are you seeing more men, more women, or does it
So
matter?
The average age we've seen, it's about between 45 and 50, an average age, we've seen it. We've gone from 17 to about 72. We've done operation on those patients because there are 72s and 72s, right? And there are 16s and 16s, health-wise.
Okay.
Right? So I've seen, it goes by waves. This month I'm doing more males than
Really?
females. But the majority, if you look in our practice, I think the majority are females.
Is there a difference between overweight and obese?
Yes.
Okay.
So overweight, if you have a BMI between 25 and 30, you're overweight. Between above 30, you're obese. Basically.
So that's something that your doctor can
Correct.
measure for you.
Correct.
What questions should someone ask their doctor if they're considering this surgery?
Are you a candidate for it? Are you ready for the lifestyle changes that you gotta have?
Up here.
Yes. Like I said, the surgery is just a tool to help you. There is no magic pill, no magic surgery, nothing. It's just you have to have the willpower to want to succeed. And the result is fantastic. I mean, you see people starting having kids, they've been trying for 10 to 20 years, but they couldn't have done it because of the obesity. You see, grandparents seeing their grandkids graduating from school, able to play with them on the ground, so off all of their meds. So, I mean, the results is there. I mean, it's proven.
But you got to put in the work.
You have
like
to put
you
in
said,
the work.
The surgery is just a small part of it.
Correct.
Dr. Teixeira, thank you very much for being with us.
Thank you very much for having us here.
When we come back, we are going to meet a woman who actually chose to have weight loss surgery and hear her story. Don't go away. Yolanda Sanchez is here to tell us her story and why she opted to have weight loss surgery. Thanks for being with us, Yolanda. First of all, what kind of surgery did you have?
I had the gastric sleeve surgery
And why'd you choose that particular one?
because it was less risky and the recovery was a lot faster.
So at your heaviest, how much did you weigh?
230 pounds,
And you're what, all of 5'2"?
5'2".
When you said like 5'4" with heels.
5'4" with heels.
So what was your life like before? Why did you decide to do this?
I decided to do this surgery because I had tried everything in the market out there to lose weight, and I would lose 20, 30 pounds and then gain 40 back. So at one point I was very depressed. I wanted to have my social life back and be able to be an example to my children. And I decided to get this done when I heard that the gastric sleeve surgery was approved in the United States.
So were you always heavy growing up, or did something happen?
No, I was very thin. Actually, I was about this size when I was a lot younger. I started gaining the weight after having my children, and I lost control. And when you fall into a depression, more or less, then you don't really focus on yourself.
Was there a moment where you said, this is what I've got to do, or was it kind of a gradual buildup? How did you come to that decision?
It was a gradual build-up, but at one point when at my last diet was one of those where you have to eat certain kinds of food and you can't stay away from that. And when I realized that I couldn't lose the weight, I told my husband, this is it, I am going for surgery. And that's when I submitted all the paperwork. I did all my homework on the recovery time, how long and what process I needed to take to get approved, and I did that.
Now, you mentioned that you were in a bit of a depression. What we don't often hear about is the psychological or the emotional part of having the surgery, the before and the after. How is your life different now from what it was then in terms of where your head is, in terms of how people respond to you?
Well, I can tell you that I'm a lot more confident in myself, the way I look, the way I feel in clothing. Before I would buy clothes because it fit. Now I buy clothes because I love the style. I'm from up north, I'm from New York, so definitely my style is what I really felt like I needed to come back, and that is the one main thing that I wanted to do. Everyone responds differently, unfortunately, when you're thinner. When you're overweight, even job opportunities don't even happen.
You said everyone responds differently, unfortunately. What do you mean?
When you're overweight, they look at you different. They look at you as you're not, you really don't have a goal, and you have no self-control of yourself. And when you really focus on what you want, that's basically the people see you differently when they see that you're thin, you watch what you eat, you exercise. They see a completely different person.
Were your friends and family always supportive of your decision?
Yes, I'm very fortunate that I have a family, my husband, my daughters. They were very supportive from the beginning. Not so much my siblings, my sisters, my brothers, but after they saw the results, they supported me 100%.
So when we were talking before the camera started rolling, you said that a lot of people said you were taking the easy way out. How do you respond to that?
That's the first thing that everyone says. And it's not the easy way out because basically you are restricted. You are completely, you get hit with different views. For example, if you get the surgery done, you know that immediately you have to change your lifestyle. It's not going back to the way it was before. You have to make right decisions when you eat. I'm not going to say that, that I've done everything the way it should be. I have at about 98%. But when I watch what I eat, I make decisions before putting something into my mouth.
Can you eat the same amount of food that you did before? Because that's one of those myths or old wives' tales or whatever it is that you hear, that your stomach can only hold like ounces of food.
No, unfortunately you can't. The good thing is that we saved a lot of money because now I share my meals with everyone.
Okay. Okay.
But you only can put in your stomach about 4 to 5 ounces.
And you just adjusted to
yes.
that.
Now, because I've been out a couple of months after my surgery, I'm able to eat about 7 to 8 ounces.
Would you recommend the surgery to someone?
Yes, and I have to many. I have referred about a couple of friends that have been approved and they had surgery as well.
So when you look back on your experience, is there anything that you would do differently?
No, I am very happy with the results. I'm happy with the service that I got from my surgeon's office, and I had no issues whatsoever.
And I'm hearing from you that the support you got, especially from your family, was a big factor as well.
Yes, you definitely need that in your life, because if you don't have the support, you're not going to be successful. At one point, I remember my family would think that I was obsessive because I would go to the gym every single day, and I still do, but I see it as more of a lifestyle change now.
Okay. Yolanda, thanks for sharing your story with us.
Thank you. You're welcome.
We will be right back. Don't go away. As we've heard, weight loss surgery isn't just about losing weight. There are some serious health issues that can be stopped, headed off at the pass, but it's also important to get support, not only from your doctor, but from those people in your life who want you to be around for healthy connections. So make sure if you're going to get weight loss surgery, you explore all of your options. I'm Annetta Wilson. Thanks for joining us. We'll see you next time on another edition of Healthy Connections.